Cysticercosis. What is cysticercosis? Cysticercosis is a parasitic infection caused by the larval stage of the pork tapeworm, Taenia Solium. This disease occurs when humans accidentally ingest the microscopic eggs of the tapeworm, which then hatch into larvae inside the intestines. These larvae can travel through the bloodstream to various parts of the body, where they form cysts, most commonly in the brain, muscles, and eyes. The cysts can lead to a wide range of health issues, some of which can be severe or even life-threatening if not properly managed. While it may often go undiagnosed, cysticercosis can cause neurological and visual complications, making it a disease that warrants attention. How is cysticercosis transmitted? Contrary to popular belief, cysticercosis is not solely transmitted through the consumption of contaminated meat. Although eating undercooked or contaminated pork can lead to infection, the primary mode of transmission is through the ingestion of eggs of the pork tapeworm. These eggs are tiny and are easily spread through contaminated hands, water, and food. The eggs can be found in contaminated food and water. If food, especially fruits and vegetables, are not thoroughly washed, they may carry these parasite eggs. Poor hygiene. When proper hand washing is not followed, especially after using the bathroom, the risk of transferring parasite eggs to the mouth increases significantly. Living in unsanitary conditions, in areas where sanitation is inadequate, the eggs can be passed through human feces, and the contamination cycle continues as these eggs end up in the environment, where they can be ingested by others. Once the eggs enter the intestines, they hatch into larvae that travel through the bloodstream, eventually reaching various tissues such as the brain, eyes, or muscles, where they form cysts. What are the symptoms of cysticercosis? Symptoms of cysticercosis can vary depending on where the cysts are located in the body and the number of cysts present. In some cases, people can live with the infection for years without symptoms, while others may experience debilitating effects. Infections involving the brain, neurocysticercosis, can lead to significant neurological issues, and cysts in the eyes may result in visual impairments. Neurocysticercosis, cysts in the brain. When the larvae reach the brain, they can cause a condition called neurocysticercosis. This is one of the most dangerous forms of cysticercosis due to its potential to cause neurological damage. Seizures. The most common symptom of neurocysticercosis is sudden, unexplained seizures. This can happen even in individuals who have no prior history of epilepsy or seizures. Headaches and dizziness. People with cysts in the brain often experience severe headaches, dizziness, or a feeling of imbalance. These symptoms can sometimes be mistaken for other conditions, which makes diagnosis more difficult. Behavioral changes. As the cysts grow, they may cause mood swings, confusion, or even personality changes. This can disrupt normal daily functioning and lead to difficulties in social and professional life. Increased intracranial pressure. In severe cases, the cysts can interfere with the normal flow of cerebrospinal fluid, leading to a rise in pressure within the skull. This can result in nausea, vomiting, and in extreme cases, life-threatening complications. Cysticercosis in the eyes. If the parasite settles in the eyes, it can result in a number of visual disturbances, which can range from mild discomfort to permanent vision loss. Blurred or double vision. This is a common symptom of ocular cysticercosis. The cysts can affect the optic nerve or the muscles controlling eye movement. Abnormal eye movement. People may also feel unusual movements or discomfort in their eyes as the cysts alter the normal functioning of the eye. Permanent vision damage. In more severe cases, the cysts can cause irreversible damage to the optic nerve or other structures of the eye, leading to permanent vision loss. Cysticercosis in muscles or skin. The infection can also affect other tissues, such as muscles and skin, leading to different kinds of symptoms. Painless lumps under the skin. These are usually the most noticeable signs of cysticercosis in the muscles or skin. While these lumps are typically painless, they can cause concern. Muscle pain or swelling. In some cases, the cysts may lead to inflammation or swelling of the muscles, causing pain and discomfort. Muscle weakness. In rare cases, the cysts can cause weakening of the affected muscles, which may interfere with movement or physical activity. How is cysticercosis diagnosed? Diagnosing cysticercosis can be challenging, especially since symptoms may mimic other conditions. However, doctors typically use advanced imaging techniques, such as CT scans or MRI, to locate the cysts in the brain, muscles, or eyes. In some cases, blood tests are also used to detect antibodies that the body has developed in response to the parasite. These diagnostic methods help doctors confirm the presence of cysts and decide on the best course of treatment. How is cysticercosis treated? Treatment for cysticercosis largely depends on the location and severity of the cysts. In some cases, the body's immune system can control the parasite on its own, and no medical intervention may be necessary. However, in more severe cases, medication or even surgical intervention may be required. Medications: there are specific antiparasitic drugs that can help to kill the cysts and prevent further damage. These medications are typically used for infections that involve the brain, as they can help reduce inflammation and the growth of new cysts. Surgery: in rare cases, surgery may be needed to remove cysts that are causing severe symptoms or are located in areas that cannot be treated with medication alone. Seizure management: if the cysts cause seizures, medications to control and prevent seizures will be considered as part of the treatment plan. How can cysticercosis be prevented? The best way to prevent cysticercosis is through good hygiene practices and improving sanitation, particularly in areas with high rates of the disease. Here are some effective ways to prevent the disease. Proper hand washing: washing your hands thoroughly with soap and water before eating and after using the bathroom is one of the most effective ways to prevent infection. Washing fruits and vegetables: always wash fruits and vegetables thoroughly, especially if you are eating them raw. This helps remove any contamination that may have occurred during harvesting or handling. Drinking safe water: avoid drinking untreated or contaminated water. Always ensure that the water you drink is filtered or boiled to kill any parasites. Improving sanitation: in areas where cysticercosis is common, improving public sanitation and waste management practices can reduce the spread of the parasite eggs.